suffered, I think, incredibly from not having an adequately funded or supported School of Public Health. There are simply not enough public health educated workers, or in Asia for that matter. There has also been an ongoing disconnect between public health studies and medicine over the past 8 years, probably longer, since the action to make it a department. Despite the stated commitment of past UH presidents and deans of schools of JAPSOM, a School of Public Health has not been supported in real terms. And that translates into political will, commitment, and action to the needed resources to build a School of Public Health. For the first time in over a decade, I think public health is actually moving in the right direction. Our faculty voted in April of 2007 to support rebuilding a School of Public Health. We actually, it appears now, can achieve the goal of rebuilding a School of Public Health by School of Public Health business plan. We also have Enlightened Public Health Leadership. It signals a very clear movement in the direction of rebuilding. Despite the current challenging economic climate, and it is very challenging at this time, we need to build a public health educational model that meets Hawaii's needs and the region that requires public health support as well, the Asia Pacific region. Other state models are fine to look at, but it is based on their own history, their needs, and their resources, not ours. Keeping a merged School of Medicine and Public Health, to my mind, shows little promise of the changes that are needed to rebuild public health education in Hawaii. With state resources tight, keeping public health under medicine continues to keep it as a low priority compared to other JAPSOM priorities. A clinical care focused and a department focused orientation continue to predominate. There is really fairly minimal public health and medicine collaboration at this time. And I don't believe we need to have public health under medicine to have synergy and collaboration. I do believe that that can occur when they are both at the same level. I think many of us would favorably consider a continuing merger if it were agreed that the adjoined institution, instead of being called the UH School of Medicine and Public Health, would be called the UH School of Public Health and Medicine. That the resources more clearly and appropriately directed to public health rather than clinical and tertiary services. Right now, I believe the School of Medicine has about $26 million annually in general funds. School of Public Health, I believe, is
1.6.
Oh, I'm sorry, Department of 1.6. Throw a little money our way, please. A lot. We need about 4.5 million to build a School of Public Health. That's relatively a small amount of money compared to what is being put into medicine. I'm all for the synergy. I'm all for the concept of working on global health and having dual degrees in medicine and public health. I think it's a wonderful thing, but I think we need to move in the direction of making public health separate and equal. Thank you.
Thank you, Nancy, and you're all here, and I think we've got about 15-20 minutes left, so I'd like to open the questions for any of our panelists. Please.
Aside from Wisconsin, what other school or university has a combined public health and medicine?
I can't rattle them off, but I know that it's not an uncommon model to have the two entities together. At Oregon Health and Science University in Portland, Oregon, where I was most recent, there was a Department of Public Health at Tom Becker, who has some affiliation with programs here. Was chair of. Tom and I worked very closely on a variety of projects, both in my initial role as the department chair for emergency medicine and subsequently as the vice dean. So, that concept of shared governance certainly is out there. What the University of Wisconsin-Madison has done is step forward and embrace it in the larger sense and make it more of a co-equal focus. And again, that's one approach. It isn't the only way in which two entities have worked together. And there are institutions where there are separate schools. The UT medical branch, where the UT Houston has separate schools. The School of Medicine is a bit larger than the School of Public Health, but they do have some bridges across between the two there. And it just really depends on what's right for the locale and how people can work together.
Here.
This question is for Dr. Hedges. Thank you for your presentation. And I just wanted to say, Nancy, thank you for distinguishing the difference between public health and medicine being separate disciplines. I think that is often overlooked. So I just wanted to acknowledge that. Dr. Hedges, what do you think of those two disciplines being separate, as we have stated that they are? Do you think that they're separate, or do you think that it's still under the same?
Well, clearly, in the U.S., we've created distinct disciplines, but I think we all have to acknowledge there's tremendous overlap, especially if we have a population and community-based focus in terms of health, both delivery and monitoring of what health represents. If we look at our colleagues throughout the world, most models of health are really interdisciplinary and emphasize the public health nature, but medicine, public health, nursing is all really part of one larger entity, usually under a Ministry of Health. And so we've kind of dichotomized the two entities a little bit, and even gone further where each of the disciplines that is linked through the public health mission are somewhat separate in terms of some body of knowledge. So you've got medicine, you've got nursing, you've got social sciences, really categorized these disciplines. And it's not always been for the betterment, I think, overall. Is it the right model? I just realize that, it is what it is, and it is partly what we're working with. But when you go back, some 50, 60 years before public health really became a separate entity, there were commonalities that really stood out in terms of when a practitioner, whether nursing or a physician in a community, was trying to help the community as a whole. They didn't necessarily distinguish themselves as a public health officer or a physician or nurse focused on public health. They were simply a healthcare practitioner that was delivering care for the community as a whole. But we have evolved our terminology, and certainly have evolved a role for public health officers that is somewhat distinct, perhaps, in our country versus how other countries provide that service.